The future of society is dependent upon food security for children. This is for consideration in World Food Crisis UN grant funding by Sarah Guillen. With thousands of children suffering from malnutrition and food insecurity in states all across the U.S., it is vital that we invest resources into solving this issue. The health of our children also dictates the future of our society as a whole. The quality of nutrition affects the ways in which our children are developing. Several micro and macronutrients have a role in brain and cognitive development, physical development, social development, and their overall health. An iron deficiency can lead to anemia. An iodine deficiency can lead to hearing impairment. A deficiency in zinc can lead to stunted growth and reoccurring infections. A deficiency in vitamin A can lead to vision loss. Vitamin B deficiencies can lead to neurological disorders, impaired cognitive function, impaired immune function. A deficiency in vitamin C can lead to low resistance to infection. And when children are faced with these deficiencies throughout early childhood, they have poor academic performances as they have trouble concentrating and learning, which leads to less of a socioeconomic production as adults, resulting in an endless cycle of poverty, which is simultaneously the cause and effect of nutrition, which is according to a journal article in the Frontiers of Public Health 2020. The best defense starts with the first 1,000 days following conception. Good, proper nutrition starts before we are even born. Proper nutrition is vital to the overall development of children, yet families all over the United States are lacking the income, education, and resources that allow one to provide the essential nutrients needed. Families are doing what they can to supplement the lack of needed income to feed their children. According to feedingamerica.org, families may need to choose between food and other needed essentials such as utilities, medical care, housing, or education, and they use coping strategies such as buying food for their families that is less expensive but also not as nutrient dense or highly processed foods. Some families obtain help from loved ones, or they water down their food and drinks in order to stretch them further, making them last for more people or for longer durations of time, or they possibly sell personal belongings in order to feed their family. Malnutrition and food insecurity are perpetuated by the poverty cycle, in which one is born into poverty. They receive inadequate nutrition, resulting in learning difficulties or illnesses that prevents them from receiving an education, further keeping them in poverty. With an investment into the care of our children's futures, we could provide families with programs such as school meals, summer meals, or revising the eligibility requirements for government aid, like the Supplemental Nutrition Assistance Program, in which families can use supplemental income in order to purchase foods that feed into their child's development. With funds, we could provide education courses to families in which they would learn the principles of adequate nutrition, but we're also provided with cooking classes and other needed resources to apply their knowledge, which could also increase the social benefits of mental health, resulting in improved focus and cognitive function.